Welcome back. We are answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. Remember, you can text your questions to the number at the bottom of the screen, 336-379-5775. All right, this text asks, how concerned should I be if I'm in a grocery store aisle with someone who is not wearing a mask?
Often, even though we have the state laws of wearing a mask out in public, I'm sure that all of us have encountered a scenario where somebody may not be wearing a mask at the store you're frequenting. What we think of close contact is that if you are within 6 feet of somebody for 15 minutes. So I think in a grocery store, if there is 1 or 2 people that you're walking past them, that risk is very low. The key component is you wearing a mask and making sure as you go back into your car to do hand hygiene.
And let me just ask a follow-up question to that for you to talk about that just a little bit more about being in close contact with someone. We all have different definitions of what that is, but what you just said is if you're within 6 feet and for 15 minutes.
Correct. That is kind of the definition that also our local public health departments use in order to identify who's at risk for further testing if you come in contact with somebody that's positive.
This next text question is, will Cone Health have a test that can show positive results for both COVID and the flu?
So there is one of the laboratory tests manufacturers are creating a test that does check for flu and SARS-CoV-2 as well as RSV all in kind of one test. Right now, I think the plans are limited to doing testing on our inpatient side, and we are trying to create a way to figure out how to do not testing for both as an outpatient. Right now, those details are still kind of in the making.
I haven't heard of this as of yet, but maybe Cone Health is doing this or talking about it. This person has texted, do you know if there's a drive-through for getting flu shots? I am at high risk and didn't even go see my doctor for the 6-month follow-up visit. We did a phone visit instead.
Yeah, that's a very good point. So I know that we are trying to plan for not only doing our testing for COVID, but also providing flu shots. I think right now, I would probably recommend also going to your local pharmacy if you see that they're administering the flu vaccine. I think that would be a safe place to get your vaccines.
Mm-hmm. Especially since a lot of them are drive up to get your prescription drugs. They may or may not be able to actually walk out there and give it to you, depending.
Yeah, I think it depends. I've heard of different.
Mm-hmm.
I've heard of people kind of getting it in their vaccines or their blood draws even in the car. So I don't doubt that many medical I think clinics and different
Mm-hmm.
healthcare systems are both ramping up to provide that increase of access to flu vaccines. So I probably would just keep a lookout in your local paper. I know that, or perhaps the Cone Health website, which they'll shortly will put up those schedules.
This person is asking, if you've been tested in May and were negative, do you need to be tested again, or how many times or how often do I need to get tested for COVID?
It depends on the person and what they do. So generally, we don't advocate for somebody to get tested routinely. If you do work with folks in a skilled nursing home or any place that has a congregate living, the thought is that people should be tested every 2 weeks. And depending on the rate in the community, it might be more frequent for that. If your job is if you are wearing your masks all the time at your work or even working from home, that's generally thought to be pretty low risk, where you would not necessarily need to be tested all the time. Definitely if you have symptoms, and then if you find out that you're in close contact with somebody that's positive, that would prompt me to get tested.
Mm-hmm. All right, we are continuing to take your text questions. The number is right there at the bottom of the screen, 336-379-5775. We've got one more segment for you to be able to ask your questions and be able to get them answered right here and right now. We hope that you'll text your questions in the break. We'll be back in just a few minutes.